Hi, this is Terry Kuti, DiepCFoundation, and we're continuing our video today at PRMA since I'm visiting San Antonio after being at the San Antonio Breast Cancer Symposium 2017. I'm with one of the nurses here at PRMA, and her name is Heather. Heather, thanks for joining us today.
No problem.
Yeah.
Thanks for inviting me.
Absolutely. I'm so glad to have you. I wanted to ask you about was drain management. And you were kind enough to bring a drain today. And so can you go ahead and go over that with us just a little bit?
Sure. So patients are typically sent home with these little things called JP drains. So the bulb, and then there is a connecting tube. The drains work off suction, so they do not have to hang low for gravity. There's no rule that states they need to be below a certain area. They are sewn into place, so they are typically a bit uncomfortable until they come out. But how the drain works is you just set it to suction, and all you do is you squeeze the air out and you put the lid on top, and then a vacuum is created and the bulb is set on suction. Gradually it will just withdraw fluid, a little bit of blood, a little bit of blood clots, a little bit of balls of fat, things like that will come out through the tubing. And then 3 times a day, around the same time every day, we ask our patients to strip the drain, which is very simple. You just grab hold of the tubing, thank you, and you want to push the tubing between your fingers to bring any of the solid material that is in the tube to collect into the bottle. Then you take the lid off of the tube or off the bulb, and then using the little measuring cup given to you by the hospital or our office, all you want to do is you want to take the bottle and pour the fluid into the measuring cup, and then re-deflate the bulb and put the lid on top. And that's it, you're done. And then record how much fluid you have in each individual bulb so that you can keep a log and your nurse will know when it is ready to be removed.
So when you say it is sewn in place, this is actually the part, even though it looks long, this is actually the part that will be inserted into your breast area so that this can then drain the fluid. And like you said, I'm glad you brought up other than just fluid, because a lot of times women get concerned if they do see those clots, if they do see those globules, it's very normal.
Yes, very normal. We expect to see it. Typically, there's a lot of fluid that comes out at first, and as the fluid decreases, the amount of solid material increases, and that's actually a good sign. That means that your body is healing, the fluid's decreasing, and your drain is going to come out very soon. And
what about color? What should they look for in color in the drain?
I typically tell my patient any color of Kool-Aid that you can think of. We have seen it all. Seriously, any color. It usually starts off a purple color because it's just very dark blood, and then it'll become more of a fruit punch. Typically dial soap color, lemonade color, sometimes clear. We've even seen green and blue. That's typically due for other reasons, typical other tests that may be done during mastectomies, and that is completely normal as well.
I think I saw a few of those colors myself in my own drains. So
it's always fun.
Yeah. So what happens in the area that comes, like say this is your skin and the drain is in here? What happens when this area gets a little bit sore? What should you look for to call a nurse about?
Typically, patients will have something that is called suture irritation. Where the drain is inserted into the skin, there is a suture or a stitch that's exiting out of the skin. And gradually over time, it will be pulled on, it will get moved, and it will be uncomfortable. Typically, about a quarter to a $1/2 size of redness around the drain site is completely normal. Unless it starts looking like fingers, streaks, or it is spreading, it's warm to the touch, you start experiencing fever or chills, it's typically pretty normal to have some irritation. Right,
sure, just because of the tugging and everything. So, excellent explanation. Thank you so much for your time today, Heather.
You're very welcome. Have a great day.
All right, bye. Thank you.